Hi everyone, welcome to Heart Health Matters, a podcast series brought to you by the Chair of Preventive Cardiology of the Maharashtra Institute of Health Sciences, powered by Madhabag Institute of Preventive Cardiology. I am Dr. Aman Kapoor and I welcome you all to this feast of knowledge that is relevant for today's world. The Chair of Preventive Cardiology of the MUHS intends to provide you with the latest information on cardiac health, cardiac diseases, how to prevent them, and how to keep your heart healthy. We assure you authenticity stamp on the contents. We shall be sharing with you our expertise, helping you navigate through the complexities of heart health and providing practical tips for preventing heart disease. With each podcast, we'll be covering different topics like risk factors, symptoms, lifestyle changes, and treatment options. If you are looking to learn about how to keep your heart and your loved one's heart healthy, then you have come to the right place. Sit up, focus, and get the gems from the experts of MUHS and MIPC.
Bypass surgery for the blockages in the coronary arteries of the heart is now quite well known. However, it continues to generate a fear amongst many. But people like us who are in cardiology field look at it as a fantastic human intervention or an invention which has added life to years and years to the lives. If we imagine the heart as a fist-shaped rounded structure, the coronary arteries are on the surface of the heart, like we have veins on the back of the fist. These arteries get clogged by cholesterol and blood clots, a disease which is known as atherosclerosis. It leads to chest pain on exertion or when completely blocked, a heart attack. Bypass surgery provides an alternative channel for the blood flow using veins and arteries from the other parts of the body. If a road is blocked, then you create a diversion. Bypass surgery is essentially the same. It fashions the blood flow around the blockages and feeds the heart beyond the blockages. If the blockages are multiple, severe, and beyond the scope of medical management or angioplasty, the bypass surgery is performed. The decision to perform a bypass surgery obviously should be left to cardiologists and cardiac surgeons. One may spend some time in choosing a doctor that you can trust. But after that, the medical decisions must be left to the doctor and trusted fully. At the beginning of 2023, coronary artery bypass graft surgery, known as CABG, is a high-level intervention of humans. It tackles a killer disease and extends life. The success rate is in excess of 90% in most of the hospitals, and in very well-established centers of the world, it could be close to 98%. This varies because the initial disease of the person could be profound, or there could be other complications like diabetes, blood pressure, obesity. So initially, if the person is reasonably good, the bypass surgery success rate can go up to 99%. In medical field, we don't say anything 100% because it cannot be. When it is decided to perform a bypass surgery, of course it is done under deep anesthesia in the cardiac operation theatre. The chest is opened up and now the heart is in front of the cardiac surgeon. The heart can be completely stopped using a heart-lung machine, or many times nowadays, bypass surgeries are performed while the heart is beating because, as we said, the arteries are on the surface of the heart. The arteries and veins which are used as the channels, as they are present in the body as if spare parts made by nature. Once they are used, a T-junction is created by a surgery called the anastomosis. Anastomosis essentially means get the outside artery and place it on the heart and join it in the form of a T. There are actually 8 to 10 microstitches performed through the magnifying glasses. It's a highly skilled surgery and you require extensive training and really confidence to do this. Once whatever blockages are to be bypassed, it may be 3 or 4, the heart is restarted, chest is closed, the patient is brought to what is called as a recovery room, which is actually a ICU after the surgery. Here the patient is observed extensively. Minute to minute observations are taking place. Sisters, ward boys, doctors are swarming around the patient every now and then. After about few days, all the tubes, lines, catheters are removed from the body. Patient is moved to walk around and is brought back to the ward. Then the process of rehabilitation starts. Physiotherapists come into action. Breathing exercises are taught. PT-like exercises are undertaken. Patient usually starts moving around on day 3, day 4 and walks home on day 7 to day 8. Majority of the people take about 4 to 6 weeks to come back to normalcy. By this time, the chest wound is practically healed. Lungs have recovered to normal. Heart is of course beating very well and has recovered because of the extra blood supply it got through the bypass surgery. After this, a long period of rehabilitation also can start, but majority of the patients can get back to work and life can become normal within a span of 6 to 8 weeks. Of course, we must remember that bypass surgery is like putting out a fire. The blockages could have caused a heart attack that is thwarted by a bypass surgery, but the tendency of the body to form blockages has to be prevented. This tendency comes from the high cholesterol levels, diabetes, smoking, and the risk factors that the patients carry. So rehabilitation means to take care of all these risk factors, control your weight to the best, blood pressure to below 130, bad cholesterol, that is LDL, to below 55 milligrams %. Heart rate should be between 70 and 80. All this is performed by the doctors and their team, and the patient is absolutely brought back to life after this. We said that the success rate could be about 95%, but the remaining 5% can get into complications like kidney failure during the surgery, a stroke during the surgery, or a post-operative wound infection. The list is long, but fortunately the percentage is very small. Newer advances which have taken place in bypass surgery are the robotic surgery. When the robots absolutely rock steady hands are used, robots require very little space to maneuver, so endoscopic surgeries are possible, and it should or will become a norm in the future. So we must remember that nobody should get into a stage where a bypass surgery is required. If somebody requires bypass surgery, means it is almost a end stage of atherosclerosis. Why reach to that level? We should start preventing from the beginning. But if somebody for some reason reaches to that stage where many arteries are clogged, medicine will not work, angioplasties are not possible, then bypass surgery is a boon. It works very well. It is a well-established surgery, and it should bring back the patients to absolutely normalcy. Beyond that starts a period of discipline, diet, exercise, medication, following parameters, regular follow-up, and it can lead to a phenomenal long period. It could be decades that patient can get extended to after a good bypass surgery and rehabilitation.
Thank you so much for those simplified gems of information about the heart. Thank you to all our listeners for joining and listening to our today's podcast. We hope you found today's episode informative and inspiring. We are here to support you in your endeavor of keeping your heart healthy. We truly care about your heart health and would like to see you succeed and remain healthy. Remember, you have the power to make positive changes in your life, and we are here to help you achieve those goals. So let us all commit to living heart healthy lives together. Thank you for being a part of this community. Until the next time, stay healthy, and before you go, do give us a like. If you have any other questions or comments, please don't hesitate to reach out to us. The link to connect with us is there in the description below. Do share this podcast with your friends and family, and also share it on your social media. Sign up for our newsletters and leave your questions or your comments below. Thank you so much for listening to us. Till the next time, this is Dr. Aman Kapoor. Bye bye. See you all. Stay healthy, stay fit and fine.